More than 2,000 striking Kaiser mental health therapists are still walking picket lines. Their strike now 8 weeks old. The continuing strike is raising questions about whether patients are getting timely access to the mental health care they need.
A new law in California now sets a timeline requiring mental health patients to be at least every 2 weeks to be seen. KTVU's Claudine Wong introduces us to two people who say they've been asking for help and they can't get it.
In some of the darkest days, Barbara McDonald would turn to music.
I would sit downstairs and hear her crying, and I would play guitar.
Her daughter would cry, battered by her struggles with mental health.
My younger daughter was exhibiting some behaviors like self-harm, disordered eating, things like that. And when she was an adolescent, even though the care seemed to be somewhat inexperienced, like therapists in training and things like that, we felt very supported and all the different components of her care.
But her daughter is now 19, and the last couple of years have told a different story.
But they don't follow up with her. So the last time she saw a psychiatrist was probably 6 months ago. I just feel in total despair in trying to get anything from Kaiser. Like, I've given up on Kaiser helping my family thrive. I don't even get the sense that they care if we survive.
That struggle is echoed by April Jordan, whose 24-year-old son called her last spring.
And just said, I can't do this anymore. I need help. I need to go back to that therapist. I need help, Mom. I need you, Mom, is what he said.
She, too, says Kaiser had helped in the past and had hoped therapists would be able to help him again. But all he got were phone numbers.
He said it was just a total runaround. He did not get any help. He did not get anybody. And he went in there, and they waited in the lobby for like over 2 hours. And he was like, I'm not leaving until I talk to someone. I'm not leaving until I talk to someone. He was there for over 2 hours. And they came out and gave him another phone number. No help. It's 1 week before he died. He tried hard as he could.
Both their children were patients at Kaiser, and with a strike by therapists entering its 8th week, Kaiser and its care have taken center stage.
Like, I want to cry. We all went into this field to be able to help people, and we're not able to because of the system.
Clinical psychologist Jessica Bergstrom wrote a blog called A Day in the Life.
So it's 9 a.m. These 30-minute sessions are frustrating, but it's the only way I can see John more frequently than every other 8 weeks. I'm so sorry, Sally. My next appointment is 7 weeks from now. It's 1:58 now, only 2 minutes before the 2 o'clock consultation meeting. I'm going to have to be late so I can call my patient who endorsed suicidal ideation. I still need to check on Jane. It's all on me. I don't have enough time. I feel so defeated.
She says the problem in part is that healthcare systems are using a medical model as a mental health model, and that doesn't work.
That's not how complex trauma is. That's not how depression is, or anxiety, or grief. And so because we have so many patients, we're booking people once every 6 to 8 weeks for therapy. And that's no longer therapy at this point.
They are issues State Senator Scott Wiener hopes will be addressed by a bill he wrote, SB 221, that went into effect in July.
The health plan must provide access to mental health appointments within 2 weeks of the initial appointment, and then 2 weeks later, and 2 weeks later.
He doesn't believe it's an issue of available therapists.
For mental health, there's much more of an incentive financially for them to minimize treatment, delay treatment, and when they have to provide more timely, comprehensive access to mental health treatment, it does impact their bottom line.
That creates more inequities. If you have money, you can get help.
It's a huge financial burden that I can't afford.
But the question is this a Kaiser problem or a bigger one?
I mean, Kaiser is not the only health plan that has these issues. It's a pretty extreme situation at Kaiser in terms of the lack of access to mental health care. And Kaiser needs to really just turn this around. This is on Kaiser to fix this.
Kaiser is defending itself. telling us, in part, in an emailed response to questions, that it supports the aim of SB 221 and calls the implementation challenging for all health plans, not just Kaiser Permanente. Kaiser also pointed to a lack of mental health professionals, calling it real and documented, and says it launched a $500,000 recruiting initiative to recruit new clinicians. Kaiser is currently under review by the state in both what's called a non-routine survey and an investigation.
Kaiser Green has got to go.
And so the strike continues. The investigations continue. The push by lawmakers continue. And patients and their families wait for help to come.
It's ridiculous. It's ridiculous.
My older daughter once said, "What do I have to do to get a psychiatric appointment with Kaiser? Do I have to hurt myself and go to the emergency room?" That's what it feels like.
Claudine Wong, KTVU, Fox 2 News.